Question 1. A 24-year-old client with a history of type 1 diabetes mellitus is admitted to the emergency department after experiencing nausea, vomiting, abdominal pain, and progressive weakness for 24 hours. Assessment findings include deep, rapid respirations, fruity breath odor, blood glucose of 540 mg per deciliter, serum bicarbonate of 10 milliequivalent/L, arterial pH of 7.12, and positive serum ketones. Which assessment finding is most characteristic of diabetic ketoacidosis, DKA, rather than hyperosmolar hyperglycemic state, HHNS? A. Blood glucose level of 540 mg per deciliter. B. Positive serum ketones with metabolic acidosis. C. Signs of dehydration and weakness. D. Elevated serum osmolality. Answer: B. Positive serum ketones with metabolic acidosis. Rationale: DKA is characterized by significant ketone production and metabolic acidosis resulting from fat breakdown due to insulin deficiency. Severe hyperglycemia, dehydration, and elevated osmolality may occur in both conditions, but ketosis with acidosis is the hallmark of DKA. Question 2. A nurse is caring for a 78-year-old client with type 2 diabetes who was brought to the emergency department from a nursing facility. The client is lethargic and severely dehydrated. Laboratory findings reveal glucose 980 mg per deciliter, pH 7.38, serum osmolality 360 mosm/kg, and absent ketones. Which interpretation of these findings is most accurate? A. Findings are consistent with DKA due to severe hyperglycemia. B. Findings suggest mixed DKA and HHNS. C. Findings are most consistent with HHNS. D. Findings indicate severe hypoglycemia. Answer: C. Findings are most consistent with HHNS. Rationale: HHNS is characterized by profound hyperglycemia, severe dehydration, elevated serum osmolality, and minimal or absent ketosis. Normal pH and absent ketones strongly support HHNS rather than DKA. Question 3. A client with newly diagnosed DKA arrives on the medical unit. Initial laboratory results show potassium 5.8 milliequivalent/L, glucose 620 mg per deciliter, pH 7.08, and bicarbonate 9 milliequivalent/L. Which nursing interpretation is most appropriate regarding the potassium level? A. Total body potassium is likely depleted despite the elevated serum level. B. Potassium stores are excessive and require immediate restriction. C. The client is experiencing renal failure as the primary cause. D. Potassium replacement should never be anticipated. Answer: A. Total body potassium is likely depleted despite the elevated serum level. Rationale: in DKA, acidosis causes potassium to shift from cells into the bloodstream, producing elevated serum levels. Despite this, total body potassium is significantly depleted due to osmotic diuresis and urinary losses. Question 4. A client admitted with DKA receives aggressive intravenous fluid therapy and a continuous insulin infusion. 2 hours later, the glucose level decreases from 680 mg per deciliter to 420 mg per deciliter. Which nursing action is most appropriate at this time? A. Discontinue insulin infusion immediately. B. Continue therapy and monitor for electrolyte changes. C. Administer sodium bicarbonate routinely. D. Restrict all intravenous fluids. Answer: B. Continue therapy and monitor for electrolyte changes. Rationale: the glucose reduction demonstrates therapeutic effectiveness. Insulin therapy should continue while monitoring potassium and other electrolytes because rapid intracellular shifts may occur during treatment. Question 5. A nurse is evaluating a client being treated for HHNS. Which assessment finding would indicate the highest priority concern requiring immediate intervention? A. Blood glucose of 450 mg per deciliter. B. Urine output of 60 milliliters per hour. C. Serum sodium of 150 milliequivalent/L. D. Sudden decrease in level of consciousness. Answer: D. Sudden decrease in level of consciousness. Rationale: neurological deterioration may indicate worsening hyperosmolarity, cerebral complications, or inadequate cerebral perfusion. Airway, breathing, circulation, and neurological status always take priority. Question 6. A client with DKA is admitted after discontinuing insulin therapy because of a viral illness. Which explanation best describes the development of ketoacidosis? A. Excess insulin causes increased ketone production. B. Lack of insulin leads to fat metabolism and ketone formation. C. Increased glucose intake directly causes ketones. D. Renal dysfunction causes metabolic alkalosis. Answer: B. Lack of insulin leads to fat metabolism and ketone formation. Rationale: without adequate insulin, glucose cannot enter cells effectively. The body breaks down fat for energy, resulting in ketone production and metabolic acidosis. Question 7. A nurse receives report on 4 diabetic clients. Which client is at greatest risk for developing HHNS? A. A 16-year-old with newly diagnosed type 1 diabetes. B. A 28-year-old with recurrent episodes of DKA. C. An 82-year-old with type 2 diabetes and pneumonia. D. A 35-year-old athlete with controlled diabetes. Answer: C. An 82-year-old with type 2 diabetes and pneumonia. Rationale: HHNS most commonly occurs in older adults with type 2 diabetes, particularly during acute illness such as infection. Infection increases stress hormones, worsening hyperglycemia and dehydration. Question 8. A client with DKA has the following laboratory values: glucose 590 mg per deciliter, potassium 3.2 milliequivalent/L, pH 7.15, bicarbonate 12 milliequivalent/L. Which provider prescription should the nurse question? A. Intravenous normal saline infusion. B. Potassium replacement therapy. C. Continuous intravenous insulin infusion. D. Cardiac monitoring. Answer: C. Continuous intravenous insulin infusion. Rationale: when potassium is below 3.3 milliequivalent/L, insulin administration may worsen hypokalemia and precipitate life-threatening arrhythmias. Potassium replacement should occur before insulin initiation. Question 9. A client with HHNS is receiving treatment. Which laboratory value would best indicate that therapy is effectively reducing hyperosmolarity? A. Increasing ketone levels. B. Decreasing serum osmolality. C. Rising arterial carbon dioxide level. D. Increasing serum bicarbonate above normal. Answer: B. Decreasing serum osmolality. Rationale: the hallmark abnormality in HHNS is severe hyperosmolarity. Improvement is demonstrated by gradual reduction in serum osmolality and improved hydration status. Question 10. A nurse is caring for a client diagnosed with DKA. Which assessment finding should the nurse expect as a compensatory response to metabolic acidosis? A. Bradypnea and shallow respirations. B. Kussmaul respirations. C. Cheyne-Stokes respirations. D. Apneustic breathing. Answer: B. Kussmaul respirations. Rationale: Kussmaul respirations are deep, rapid respirations that help eliminate carbon dioxide and partially compensate for metabolic acidosis in DKA. This respiratory pattern is a classic finding. Question 11. A 56-year-old client with type 1 diabetes is admitted with severe DKA. Initial laboratory results reveal glucose 720 mg per deciliter, potassium 5.6 milliequivalent/L, pH 7.09, and bicarbonate 8 milliequivalent/L. 4 hours after treatment is initiated with 4 fluids and insulin, the potassium level decreases to 3.4 milliequivalent/L. Which nursing action is the priority? A. Increase the insulin infusion rate. B. Anticipate potassium replacement as prescribed. C. Restrict oral and 4 fluids. D. Administer sodium bicarbonate immediately. Answer: B. Anticipate potassium replacement as prescribed. Rationale: as insulin therapy moves potassium back into the cells, serum potassium levels fall rapidly. Hypokalemia can lead to life-threatening dysrhythmias. Therefore, potassium replacement becomes a priority once levels decline. Question 12. A client admitted with HHNS has been receiving aggressive fluid resuscitation for several hours. Which assessment finding best indicates that fluid replacement is effective? A. Persistent tachycardia of 130 per minute. B. Urine output of 45 milliliters per hour with improved blood pressure. C. Serum glucose remains above 600 milligrams per deciliter. D. Increasing confusion and restlessness. Answer: B. Urine output of 45 milliliters per hour with improved blood pressure. Rationale: adequate urine output and stabilization of blood pressure indicate improved intravascular volume and tissue perfusion. Persistent tachycardia and worsening mental status suggest inadequate treatment. Question 13. A nurse is reviewing laboratory results for two diabetic clients. Client A: glucose 560 milligrams per deciliter. pH 7.11. Positive ketones. Client B: glucose 940 milligrams per deciliter. pH 7.39. Serum osmolality 355 mosm/kg. Which client is at greater risk for seizures? A. Client A because of metabolic acidosis. B. Client A because of ketosis. C. Client B because of severe hyperosmolarity. D. Both clients have equal risk. Answer: C. Client B because of severe hyperosmolarity. Rationale: extreme hyperosmolarity in HHNS significantly increases the risk of neurological complications, including seizures, focal deficits, and coma. Question 14. A client is admitted with DKA after 3 days of vomiting and inability to tolerate food. Which pathophysiological process is primarily responsible for the client's metabolic acidosis? A. Excessive bicarbonate retention. B. Lactic acid production from hypertension. C. Ketone accumulation from fat metabolism. D. Excessive carbon dioxide retention. Answer: C. Ketone accumulation from fat metabolism. Rationale: insulin deficiency causes lipolysis and production of ketone bodies. Accumulation of ketones results in metabolic acidosis, the hallmark of DKA. Question 15. A nurse is caring for a client with HHNS whose glucose level has decreased from 980 milligrams per deciliter to 290 milligrams per deciliter during treatment. Which prescription should the nurse anticipate next? A. Discontinuation of insulin therapy immediately. B. Addition of dextrose-containing 4 fluids. C. Administration of glucagon. D. Fluid restriction. Answer: B. Addition of dextrose-containing 4 fluids. Rationale: once glucose approaches approximately 250 to 300 mg/dl, dextrose is often added to prevent hypoglycemia, while insulin therapy continues to correct metabolic abnormalities and hyperosmolarity. Question 16. A nurse is assessing a client with suspected DKA. Which finding most strongly supports the diagnosis? A. Blood glucose 800 milligrams per deciliter and absent ketones. B. Warm, dry skin, and severe hypernatremia. C. Fruity breath odor and Kussmaul respirations. D. Serum osmolality of 360 mosm/kg. Answer: C. Fruity breath odor and Kussmaul respirations. Rationale: fruity breath from acetone and Kussmaul respirations caused by metabolic acidosis are classic manifestations of DKA and are less characteristic of HHNS. Question 17. A client being treated for DKA suddenly develops muscle weakness, flattened T waves, and premature ventricular contractions on cardiac monitoring. Which complication should the nurse suspect? A. Hypercalcemia. B. Hypermagnesemia. C. Hypokalemia. D. Hypernatremia. Answer: C. Hypokalemia. Rationale: potassium shifts into cells during insulin therapy. Muscle weakness, ECG changes, and ventricular dysrhythmias are classic manifestations of hypokalemia. Question 18. A 70-year-old client with HHNS becomes increasingly confused despite a gradual reduction in blood glucose. Which assessment should the nurse perform first? A. Evaluate neurological status and level of consciousness. B. Assess bowel sounds. C. Measure abdominal girth. D. Evaluate peripheral edema only. Answer: A. Evaluate neurological status and level of consciousness. Rationale: neurological deterioration may indicate worsening cerebral perfusion, cerebral edema, or persistent hyperosmolarity. Immediate neurological assessment is the priority. Question 19. A client with DKA has received 3 liters of normal saline. The nurse notes improving blood pressure, decreasing heart rate, and increased urine output. Which conclusion is most appropriate? A. Fluid volume deficit is improving. B. DKA has completely resolved. C. Insulin therapy should be discontinued. D. Potassium replacement is no longer needed. Answer. A. Fluid volume deficit is improving. Rationale. Improved hemodynamic parameters and urine output indicate effective volume replacement. Resolution of DKA requires normalization of glucose, anion gap, bicarbonate, and acid-base status. Question 20. A nurse is preparing discharge teaching for a client who was hospitalized with DKA precipitated by influenza. Which statement by the client indicates a need for further teaching? A. I will continue taking insulin even when I am sick. B. I should monitor my blood glucose more frequently during illness. C. If I cannot eat normally, I should stop my insulin until I feel better. D. I should drink fluids and contact my provider if glucose remains elevated. Answer. C. If I cannot eat normally, I should stop my insulin until I feel better. Rationale. Illness often increases insulin requirements due to stress hormone release. Stopping insulin during illness is a common cause of DKA and places the client at high risk for recurrence. Question 21. A 22-year-old client with type 1 diabetes is admitted with DKA. Laboratory findings include glucose, 610 milligrams per deciliter, pH, 7.18, HCO3, 11 milliequivalent/L, PaCO2, 24 millimeters of mercury. How should the nurse interpret these findings? A. Respiratory acidosis with no compensation. B. Metabolic alkalosis with respiratory compensation. C. Metabolic acidosis with respiratory compensation. D. Respiratory alkalosis with metabolic compensation. Answer. C. Metabolic acidosis with respiratory compensation. Rationale. The low pH and low bicarbonate indicate metabolic acidosis. The decreased PaCO2 reflects compensatory hyperventilation, Kussmaul respirations, to remove carbon dioxide and partially correct the acidosis. Question 22. A nurse is caring for a client admitted with HHNS. The client becomes increasingly restless and difficult to arouse. Which action should the nurse perform first? A. Check neurological status and airway patency. B. Administer prescribed insulin immediately. C. Obtain a urine specimen. D. Encourage oral fluids. Answer. A. Check neurological status and airway patency. Rationale. Changes in mental status may signal worsening hyperosmolarity, cerebral complications, or decreased cerebral perfusion. Airway and neurological assessment are priority interventions. Question 23. A client receiving treatment for DKA has the following laboratory values 4 hours after admission. Glucose, 310 milligrams per deciliter. Potassium, 3.1 milliequivalent/L. pH, 7.25. Which prescription should the nurse anticipate? A. Increase insulin infusion significantly. B. Hold potassium replacement. C. Continue potassium replacement and close cardiac monitoring. D. Restrict intravenous fluids. Answer. C. Continue potassium replacement and close cardiac monitoring. Rationale. Potassium levels below normal during DKA treatment increase the risk for serious dysrhythmias. Ongoing replacement and ECG monitoring are critical. Question 24. A nurse is reviewing the history of 4 clients. Which client is at highest risk for developing DKA? A. A 75-year-old with type 2 diabetes and dehydration. B. A 20-year-old with type 1 diabetes who stopped taking insulin. C. A 68-year-old receiving tube feedings. D. A 60-year-old with controlled type 2 diabetes. Answer. B. A 20-year-old with type 1 diabetes who stopped taking insulin. Rationale. Absolute insulin deficiency is the major precipitating factor for DKA. Omission of insulin is one of the most common causes. Question 25. A client with HHNS is receiving intravenous fluids. Which assessment finding indicates the greatest improvement? A. Blood glucose decreases from 950 milligrams per deciliter to 700 milligrams per deciliter. B. Heart rate decreases from 132 per minute to 92 per minute. C. Urine-specific gravity remains elevated. D. Serum osmolality remains unchanged. Answer. B. Heart rate decreases from 132 per minute to 92 per minute. Rationale. Improvement in tachycardia suggests restoration of intravascular volume and improved perfusion. Persistent hyperosmolarity and concentrated urine indicate ongoing dehydration. Question 26. A client presents with severe hyperglycemia. Which finding most strongly favors HHNS over DKA? A. Glucose 1050 mg per deciliter. B. Positive ketones. C. Kussmaul respirations. D. Arterial pH of 7.12. Answer. A. Glucose 1050 mg per deciliter. Rationale. Although overlap may occur, extremely high glucose levels are more characteristic of HHNS. Significant ketosis, Kussmaul respirations, and severe acidosis are classic DKA findings. Question 27. A client with DKA has been receiving treatment for 6 hours. Which finding best indicates resolution of ketoacidosis? A. Glucose level falls below 250 mg per deciliter only. B. Urine output exceeds 100 milliliters per hour. C. Closure of the anion gap and normalization of bicarbonate levels. D. Potassium level reaches 4.0 milliequivalent/L. Answer. C. Closure of the anion gap and normalization of bicarbonate levels. Rationale. DKA is considered resolved when ketoacidosis has corrected, evidenced by normalization of the anion gap, bicarbonate level, and pH, not merely by improvement in blood glucose. Question 28. A nurse caring for a client with HHNS reviews the following findings. Blood glucose, 920 mg per deciliter. Serum osmolality, 370 mosm/kg. Sodium, 154 milliequivalent/L. pH, 7.39. Which complication is the client at greatest risk for? A. Cerebral dysfunction and coma. B. Severe respiratory acidosis. C. Tetany from hypocalcemia. D. Pulmonary embolism secondary to alkalosis. Answer. A. Cerebral dysfunction and coma. Rationale. Extreme hyperosmolarity causes neuronal dehydration, resulting in confusion, seizures, focal deficits, and coma. Question 29. A client recovering from DKA asks why insulin therapy was continued even after glucose levels approached normal. Which response by the nurse is most accurate? A. Insulin is continued until the acidosis and ketone production resolve. B. Insulin is only used to lower glucose levels. C. Stopping insulin early prevents hypokalemia. D. Insulin is continued primarily to reduce serum sodium. Answer. A. Insulin is continued until the acidosis and ketone production resolve. Rationale. Correction of ketoacidosis is the primary treatment goal. Glucose may normalize before ketone production stops. Therefore, insulin therapy must continue until metabolic abnormalities resolve. Question 30. A nurse receives report on 4 clients. Which client should be assessed first? A. A client with HHNS whose glucose decreased from 980 mg per deciliter to 600 mg per deciliter. B. A client with DKA reporting mild nausea. C. A client receiving DKA treatment who develops new ventricular ectopy on cardiac monitoring. D. A client with HHNS whose urine output is 55 milliliters per hour. Answer. C. A client receiving DKA treatment who develops new ventricular ectopy on cardiac monitoring. Rationale. New ventricular ectopy suggests potentially life-threatening electrolyte abnormalities, especially hypokalemia. Dysrhythmias can rapidly progress to cardiac arrest and require immediate assessment and intervention. Question 31. A 19-year-old client with type 1 diabetes is admitted with severe DKA. 2 hours after initiation of 4 insulin therapy, the nurse notes the following. Blood glucose, 430 mg per deciliter, down from 710 mg per deciliter. Potassium, 3.0 milliequivalent/L. Heart rate, 118 per minute. Presence of premature ventricular contractions, PVCs. Which nursing action is the priority? A. Continue insulin at the current rate and reassess in 1 hour. B. Notify the provider and anticipate immediate potassium replacement. C. Administer sodium bicarbonate as prescribed PRN. D. Increase 4 fluids to rapidly lower glucose. Answer. B. Notify the provider and anticipate immediate potassium replacement. Rationale. Hypokalemia accompanied by ventricular ectopy places the client at risk for lethal dysrhythmias. Correction of potassium abnormalities is a priority during DKA treatment. Question 32. A client with HHNS is admitted from a long-term care facility. Assessment findings include blood glucose, 1,120 mg per deciliter. Serum osmolality, 385 mmOsm/kg. Dry mucous membranes. Blood pressure, 82/48 mm of mercury. Which prescription should the nurse implement first? A. Administer 4 regular insulin. B. Begin aggressive isotonic fluid replacement. C. Administer potassium chloride. D. Restrict oral intake. Answer. B. Begin aggressive isotonic fluid replacement. Rationale. Severe dehydration and circulatory collapse are the most immediate threats in HHNS. Fluid replacement is the first-line intervention to restore perfusion and improve hemodynamic stability. Question 33. A client with DKA has the following arterial blood gas results. pH, 7.10. PaCO2, 22 mm of mercury. HCO3, 9 milliequivalent/L. Which assessment finding should the nurse expect? A. Slow, shallow respirations. B. Respiratory depression. C. Deep, rapid respirations. D. Absent breath sounds. Answer. C. Deep, rapid respirations. Rationale. Kussmaul respirations occur as the body attempts to compensate for metabolic acidosis by eliminating carbon dioxide through deep, rapid breathing. Question 34. A nurse is evaluating outcomes for a client treated for HHNS. Which finding best indicates that treatment has been effective? A. Serum osmolality decreases toward normal range. B. Positive ketones are present in urine. C. Bicarbonate decreases below 15 milliequivalent/L. D. Arterial pH decreases to 7.20. Answer. A. Serum osmolality decreases toward normal range. Rationale. Reduction of serum osmolality indicates correction of the severe dehydration and hyperosmolar state characteristic of HHNS. Question 35. A nurse is caring for 4 clients. Which client should be seen first? A. Client with DKA whose glucose is 250 mg per deciliter and receiving dextrose-containing 4 fluids. B. Client with HHNS reporting thirst and dry mouth. C. Client with DKA who suddenly becomes difficult to arouse. D. Client with HHNS whose blood pressure improved after fluids. Answer. C. Client with DKA who suddenly becomes difficult to arouse. Rationale. A sudden decrease in consciousness may indicate cerebral edema, worsening metabolic abnormalities, or neurological compromise, and requires immediate assessment. Question 36. A 67-year-old client is admitted with suspected HHNS. Which laboratory pattern would the nurse expect? A. Glucose 580 mg per deciliter, pH 7.08, positive ketones. B. Glucose 980 mg per deciliter, pH 7.36, minimal ketones. C. Glucose 450 mg per deciliter, pH 7.25, large ketones. D. Glucose 390 mg per deciliter, pH 7.18, Kussmaul respirations. Answer. B. Glucose 980 mg per deciliter, pH 7.36, minimal ketones. Rationale. HHNS typically presents with profound hyperglycemia, minimal ketosis, and little or no acidosis. Question 37. A nurse is reviewing laboratory results for a client recovering from DKA. Which finding suggests the greatest risk for recurrence after discharge? A. Hemoglobin A1C of 12.8%. B. Potassium level of 4.2 milliequivalent/L. C. Sodium level of 138 milliequivalent/L. D. bicarbonate level of 24 milliequivalent/L. Answer: A. Hemoglobin A1C of 12.8%. Rationale: a markedly elevated A1C reflects chronic, poor glycemic control and significantly increases the risk of future DKA episodes. Question 38. A client receiving treatment for HHNS develops crackles in both lung bases and increasing dyspnea. Which complication should the nurse suspect? A. Pulmonary edema related to fluid therapy. B. Progression to ketoacidosis. C. Hyperkalemia-induced respiratory failure. D. Acute pancreatitis. Answer: A. Pulmonary edema related to fluid therapy. Rationale: aggressive fluid replacement is essential in HHNS, but may cause fluid overload, especially in older adults and those with cardiac dysfunction. Question 39. A nurse is educating a newly diagnosed type 1 diabetic client about preventing DKA during illness. Which statement by the client indicates correct understanding? A. I should stop insulin when I cannot eat. B. I only need to check glucose once daily during illness. C. I should monitor glucose and ketones more frequently when sick. D. I should avoid drinking fluids if I have vomiting. Answer: C. I should monitor glucose and ketones more frequently when sick. Rationale: sick day management includes continuing insulin, monitoring glucose and ketones frequently, maintaining hydration, and seeking medical assistance when glucose remains elevated. Question 40. A client with DKA has the following laboratory values: glucose, 240 milligrams per deciliter; pH, 7.18; HCO3, 12 milliequivalent/L. Positive serum ketones. Which nursing interpretation is most accurate? A. DKA has resolved because glucose is below 250 milligrams per deciliter. B. Insulin infusion should be discontinued immediately. C. Ketoacidosis persists despite improved glucose levels. D. Hyperosmolarity is the primary problem. Answer: C. Ketoacidosis persists despite improved glucose levels. Rationale: DKA resolution is determined by correction of acidosis and closure of the anion gap, not by glucose level alone. Persistent acidosis and ketones indicate ongoing DKA. Question 41. A 23-year-old client with type 1 diabetes is admitted with severe DKA. 6 hours after treatment begins, the nurse reviews the following laboratory values: glucose, 220 milligrams per deciliter; pH, 7.14; HCO3, 11 milliequivalent/L. Positive serum ketones. Which action should the nurse anticipate? A. Discontinue insulin infusion immediately. B. Continue insulin infusion and administer dextrose-containing 4 fluids. C. Administer glucagon. D. Restrict carbohydrate intake. Answer: B. Continue insulin infusion and administer dextrose-containing 4 fluids. Rationale: although the glucose level has improved, ketoacidosis persists as evidenced by the low pH, low bicarbonate, and positive ketones. Insulin therapy must continue until acidosis resolves. Dextrose is added to prevent hypoglycemia while insulin continues to suppress ketone production. Question 42. A charge nurse is assigning clients to staff members. Which client should be assigned to the most experienced RN? A. Stable client with type 2 diabetes awaiting discharge teaching. B. Client recovering from HHNS with stable vital signs. C. Client with DKA receiving 4 insulin who develops a potassium level of 2.9 milliequivalent/L. D. Client requiring routine blood glucose monitoring. Answer: C. Client with DKA receiving 4 insulin who develops a potassium level of 2.9 milliequivalent/L. Rationale: severe hypokalemia during insulin therapy presents a high risk for fatal cardiac dysrhythmias and requires advanced assessment, interpretation, and intervention by an experienced RN. Question 43. A nurse is caring for a client with HHNS. Which finding requires immediate notification of the provider? A. Serum osmolality decreases from 370 to 340 mosm/kg. B. Blood glucose decreases from 980 to 620 milligrams per deciliter. C. New onset seizure activity. D. Urine output increases to 50 milliliters per hour. Answer: C. New onset seizure activity. Rationale: severe neurological complications such as seizures indicate significant cerebral dysfunction and require immediate intervention. This is an emergency finding. Question 44. A client is admitted with suspected DKA. Which assessment finding most likely resulted from metabolic acidosis? A. Polyuria. B. Kussmaul respirations. C. Polydipsia. D. Blurred vision. Answer: B. Kussmaul respirations. Rationale: Kussmaul respirations are a compensatory mechanism in response to metabolic acidosis. The body attempts to reduce acidity by exhaling carbon dioxide through deep, rapid respirations. Question 45. A nurse receives report on 4 diabetic clients. Which client should be assessed first? A. Client with HHNS whose glucose level is 580 mg per deciliter and improving. B. Client with DKA reporting mild abdominal pain. C. Client with DKA whose cardiac monitor shows new ventricular tachycardia. D. Client with HHNS requesting water. Answer: C. Client with DKA whose cardiac monitor shows new ventricular tachycardia. Rationale: ventricular tachycardia is a life-threatening dysrhythmia that may result from electrolyte abnormalities during DKA treatment. Immediate assessment and intervention are required. Question 46. A client with HHNS has been receiving treatment for 8 hours. Which assessment finding best indicates improvement in cerebral perfusion? A. Increasing serum osmolality. B. Persistent confusion and lethargy. C. Improved orientation to person, place, and time. D. Rising serum sodium level. Answer: C. Improved orientation to person, place, and time. Rationale: improvement in mental status is one of the best indicators that cerebral dehydration and hyperosmolarity are resolving. Question 47. A client with DKA asks why abdominal pain occurs during the episode. Which response by the nurse is most accurate? A. Abdominal pain commonly occurs because of severe metabolic acidosis. B. Abdominal pain occurs from elevated insulin levels. C. It is caused by excess sodium retention. D. It results primarily from dehydration of the kidneys. Answer: A. Abdominal pain commonly occurs because of severe metabolic acidosis. Rationale: abdominal pain, nausea, and vomiting are common manifestations of DKA and are associated with the severity of metabolic acidosis. Question 48. A nurse is evaluating a client being treated for DKA. Which laboratory finding best demonstrates resolution of the emergency? A. Glucose level below 250 mg per deciliter only. B. Closure of the anion gap and normalization of bicarbonate levels. C. Potassium level above 5.0 milliequivalent/L. D. Presence of trace urine ketones. Answer: B. Closure of the anion gap and normalization of bicarbonate levels. Rationale: the definitive evidence of DKA resolution is correction of ketoacidosis, reflected by closure of the anion gap and normalization of bicarbonate and pH values. Question 49. A nurse is caring for a client admitted with HHNS secondary to pneumonia. Which pathophysiological process most likely contributed to development of HHNS? A. Excess insulin secretion causing hypoglycemia. B. Stress hormone release causing profound hyperglycemia and dehydration. C. Increased ketone production causing severe acidosis. D. Excess bicarbonate loss through the kidneys. Answer: B. Stress hormone release causing profound hyperglycemia and dehydration. Rationale: infection triggers the release of stress hormones such as cortisol and catecholamines, leading to severe hyperglycemia, osmotic diuresis, dehydration, and development of HHNS. Question 50. A 72-year-old client with type 2 diabetes is admitted with HHNS. 12 hours after treatment begins, the nurse notes: blood glucose, 290 mg per deciliter. Serum osmolality, 305 mmOsm/kg. Blood pressure, 118/72 mmHg. Alert and oriented times 4. Urine output, 55 milliliters per hour. Which interpretation is most appropriate? A. The client is demonstrating expected improvement with therapy. B. The client is progressing toward DKA. C. Immediate discontinuation of all treatment is required. D. The client remains in severe hyperosmolar crisis. Answer: A. The client is demonstrating expected improvement with therapy. Rationale: improvement in glucose level, near normal serum osmolality, stable hemodynamics, adequate urine output, and normal mental status indicate successful treatment and recovery from HHNS. Congratulations on completing 50 Nclex, the most difficult DKA versus HHNS questions, the most failed diabetes emergency. DKA and HHNS remain two of the most frequently tested and most commonly confused diabetes emergencies on the Nclex. Success comes from recognizing the critical differences. DKA, ketones present, metabolic acidosis, rapid onset, commonly associated with type 1 diabetes. HHNS, extreme hyperglycemia, severe dehydration, little or no ketosis, gradual onset, commonly associated with type 2 diabetes. Always prioritize airway, breathing, circulation, fluid replacement, electrolyte monitoring, and insulin therapy. Watch closely for potassium shifts, neurological changes, and signs of worsening dehydration. The Nclex often tests these conditions through priority questions, laboratory interpretation, delegation, and clinical judgment scenarios. Focus on understanding the pathophysiology rather than memorizing isolated facts. Thank you for practicing with MCQs Master 101. Continue challenging yourself with high-level Nclex questions. And remember, every difficult question you master today builds the clinical judgment you will need as a future nurse. See you in the next Nclex practice session.